You ever noticed a small lump on your body and ignored it, thinking it was nothing? It's easy to dismiss these things, especially as we age. But what if that tiny lump was actually a warning sign of something much more serious? As we get older, our bodies go through countless changes, some harmless, and others potentially life-threatening. That's why understanding what these lumps mean and how to detect them early is absolutely crucial. The truth is, after the age of 60, our immune systems naturally weaken, making us more susceptible to a variety of health conditions. Some lumps may be nothing more than benign cysts or fatty deposits, while others could be the first sign of a dangerous underlying condition like cancer. Ignoring these warning signs could be a fatal mistake. The key is knowing when to take action and how to differentiate between what's harmless and what requires immediate medical attention. The science behind body lumps is complex, but understanding it can help us make better health decisions. Lumps form for a variety of reasons, ranging from fluid-filled cysts to solid tumors. At a cellular level, lumps can be caused by abnormal cell growth, inflammation, or the accumulation of fat and other substances. Cancerous lumps arise when cells begin to divide uncontrollably due to genetic mutations. These mutations can be triggered by environmental factors, aging, or inherited genetic predispositions. The key difference between benign and malignant lumps lies in how these cells behave. Benign lumps remain localized and do not invade nearby tissues, whereas malignant ones can spread to other parts of the body through the bloodstream or lymphatic system. Many people assume that lumps are always associated with pain, but that's not always the case. Some of the most dangerous lumps develop silently, without any pain or discomfort. This makes them even more deceptive because they don't cause immediate concern. A painless lump might be something as simple as a swollen lymph node due to an infection, but it could also be a tumor growing unnoticed. The only way to be sure is by paying close attention to any new lumps and seeking medical advice without delay. Lumps can appear anywhere on the body, under the skin, on the neck, armpits, groin, or even internally, where they may not be immediately visible. Some of the most alarming lumps are found in the breast, as they can be an early indicator of breast cancer, which doesn't only affect women but can also develop in men. Lumps in the neck or throat could be linked to thyroid issues, while those in the groin or underarms could signal swollen lymph nodes, which may be a sign of infection, immune disorders, or even lymphoma. The body's lymphatic system plays a crucial role in the formation of lumps. Lymph nodes act as filters, trapping harmful bacteria, viruses, and abnormal cells. When these nodes become swollen, it is often a sign that the body is fighting an infection or disease. However, persistent swelling could indicate something more serious, such as lymphoma or leukemia. Scientific studies show that malignant lymph nodes tend to be firmer, immovable, and persist longer than those caused by simple infections. One of the biggest mistakes people make is assuming that a lump isn't serious if it doesn't change in size. While rapid growth is certainly a red flag, even a lump that remains the same for months could still be a cause for concern. Some cancers develop slowly over time, giving the illusion that they are not progressing, when in reality they are silently spreading beneath the surface. That's why regular checkups with a doctor are essential, especially for seniors who may already be at a higher risk for serious health conditions. So, what should you do if you find a lump on your body? The first step is observation. Take note of its size, texture, and whether it moves under the skin or feels firmly attached. Soft, movable lumps are often benign, like lipomas, which are just fatty growths. However, if a lump is hard, immovable, or rapidly growing, it could be something far more dangerous. Additionally, if a lump is accompanied by symptoms like unexplained weight loss, night sweats, or persistent fatigue, these could be warning signs of a more serious illness that needs immediate medical evaluation. Early detection is truly a lifesaver. Many cancers, including skin cancer, breast cancer, and lymphoma, have much higher survival rates when caught early. This is why self-examinations and routine doctor visits should never be overlooked. If a lump is found, a doctor may order tests such as ultrasounds, biopsies, or MRIs to determine whether it is benign or malignant. The sooner this process begins, the better the chances of effective treatment and recovery. Medical imaging techniques such as MRI and CT scans are instrumental in diagnosing lumps. These technologies use advanced scanning methods to produce detailed images of internal structures, allowing doctors to assess whether a lump is solid or fluid-filled. A biopsy, in which a small tissue sample is taken and analyzed under a microscope, is often necessary for a definitive diagnosis. Modern genetic testing can also identify specific markers associated with cancerous tumors, further aiding in early detection and treatment planning. Preventative care is just as important as early detection. While not all lumps can be avoided, maintaining a healthy lifestyle can significantly reduce the risk of developing certain types of tumors. This includes eating a balanced diet rich in antioxidants, avoiding processed foods, and staying physically active. Additionally, avoiding tobacco and limiting alcohol consumption can greatly decrease the chances of developing cancers that may first appear as lumps in the body. Another critical factor is awareness. Many people simply don't know what to look for, and by the time they seek medical help, it's often too late. This is why it's so important to talk openly about these issues, educate ourselves and our loved ones, and remove the fear and stigma around discussing our health. There's nothing embarrassing about taking control of your well-being and ensuring that any potential warning signs are addressed as early as possible. Our health is in our hands, and we must listen to our bodies. If a lump appears suddenly or changes over time, it's always better to be safe than sorry. The consequences of ignoring a warning sign can be devastating, and taking action early can mean the difference between a simple medical procedure and a life-threatening disease. There are countless cases where people have ignored small lumps, only to discover later that they were symptoms of aggressive cancers that could have been treated if caught earlier. One important thing to understand is that not all lumps are the same. Some are soft, some are firm, some grow rapidly, and others stay the same. A lump in the armpit might be related to an infection or inflammation, while a lump under the jaw could be due to swollen lymph nodes. However, a lump that continues to grow, feels hard, or is accompanied by other unusual symptoms should always be checked by a professional. Even if a lump turns out to be harmless, the peace of mind that comes from knowing the truth is invaluable. It's always better to be cautious and seek medical advice rather than waiting and hoping it will go away. Many serious diseases can be prevented or managed effectively when they are detected in their early stages. Medical advancements have given us the ability to diagnose and treat conditions more accurately than ever before, but early detection remains the most crucial factor in successful treatment. Ultimately, being proactive about health is the best approach. Don't let fear or uncertainty prevent you from taking action. If you find a lump, get it checked. If you feel something is wrong, trust your instincts and seek professional help. Your health is too important to take risks with, and the sooner you act, the better your chances of staying strong and healthy for years to come. Time is of the essence when it comes to your health. A lump that appears harmless today could turn into something deadly if left unchecked. Don't wait until it's too late. Take control of your health now and ensure that any unusual changes in your body are properly examined. The smallest action today could save your life tomorrow, If you or someone you know has noticed an unusual lump, now is the time to act. Don't gamble with your health. Get it checked before it's too late.